Watch this video till the end to know all the buzzwords and the science related to the non-infectious diseases in the dermatology. Hello dear students, myself Dr. Maddineni Srinivas. Let us begin the discussion with Nikolsky's sign, which is very important sign in the vesiculobullous disorders. And please remember, this is going to be seen in conditions wherever there is going to be underlying acantholysis. So it is seen positive in the intraepidermal blistering disorders pemphigus, in which we are going to apply a tangential pressure on the perilesional skin, where there is going to be separation of the epidermis from the underlying dermis, leading to the formation of this erosion, as you are able to see here. So this is what is called as positive Nikolsky sign, very important. Next is the bulla spread sign, which can be seen positive in the intraepidermal blistering disorder pemphigus group and also in the pemphigoid group, which are subepidermal blistering disorders. So basically here we are going to apply the perpendicular pressure over the bulla if the bulla is very small in size, where we call it as Asbo-Hansen sign, and if the bulla is big, then we are going to call it as bulla spread sign, where we are going to apply pressure laterally. Ultimately what will happen, there is going to be extension of the blister beyond the border. So this is what is called as bulla spread sign or Asbo-Hansen sign, depending upon size of the bulla. Next is the Zhang cell, and I hope all you have watched already the infectious diseases. In the herpes infections, we have already seen the Zhang cells will be positive. Basically, these are the acantholytic cells, which are going to be rounded keratinocytes, which will have a central hyperchromatic nucleus and a perinuclear halo. So in pemphigus, we are going to see the acantholytic cells or Zhang cells, which are basically the keratinocytes. Next is cluster of jewels sign or cluster of jewels appearance, crown of jewels appearance, string of pearls appearance, all of them are one and the same. It is seen classically in CBDC, which is chronic bullous dermatosis of childhood, which is linear IgA disease, in which we are going to see the appearance of the new lesions at the margin of the older ones. So like this, the vesicles and bullous lesions will be formed surrounding a older lesion, which is going to give rise to the appearance of the cluster of the jewels. So it is called as cluster of jewels sign. Next, in the papillosquamous disorder, psoriasis is very important, and also lichen planus. So in the psoriasis, whenever the patients are going to have the silvery white micaceous scales over the extensor surfaces, take a glass slide and try to scrape off the lesion. We are going to see that this scraping of the lesion is called as a grattage test, and ultimately we are going to see the scales will be removed. This is, what is called as a candle wax sign. So once the bulkless membrane, which is a white membrane seen at the end of the scraping, is also removed, we are going to see pinpoint, small pinpoint bleeding spots, and this is the end point of the important sign, which is called as the Auspitz sign. So here you are able to see the presence of the multiple pinpoint bleeding spots on removal of the scaling, which is Auspitz sign, which is again seen in the psoriasis. In psoriasis, we are going to see a hypopigmented rim surrounding the psoriatic lesions due to the usage of the steroids. This is what is called as Warnoff's rings, as you are able to see here as hypopigmented rim, which is present surrounding the lesion. In the nails of the psoriasis, if you observe carefully, we are going to see that as if a drop of oil is present below the nail plate, there is going to be this yellowish discoloration, which is called as oil drop sign. This is also called as salmon patch, and please remember, this is the pathognomonic sign in the nail psoriasis. So this is a pathognomonic sign in the nail psoriasis. Next, in the lichen planus, please remember, we are going to have what is called as a Wickham's stripe, in which there is going to be white lacy or reticulate network like pattern, which will be seen over the skin and also over the mucosa. Wickham's stripe, very important buzzword. Next is the lichen planus. We are going to see the most common nail finding is a thinning of the nails. Because of this excessive thinning, they will become very fragile, and now we are going to see the nail is going to have a shape just like a tent. So this is what is called as a pup tent sign. Pup tent sign. Next, in the pityriasis rosacea, which is also a papillosquamous disorder, in which you are going to initially see a herald patch, which is also called as a mother patch. So ultimately, they are going to be, after 2 weeks, multiple daughter lesions developing along Christmas tree pattern over the body along the Langer's lines. So in the herald patch, if you stretch the lesion, it was observed that the scales are folding like curtains. So this is what is called as a hanging curtain sign. This is what is called hanging curtain sign. In the connective tissue disorders, dermatomyositis is very important, where we are going to see skin changes. Many signs will be there. We are going to discuss that along with the proximal muscle weakness. I hope all of you know this. So if there is a violaceous macular erythema present periorbital, we call it as heliotrope rash, as you are able to see here. This is heliotrope rash. Next, if there is violaceous macular erythema and papular lesions present in the interphalangeal joints and also in the metacarpophalangeal joints, we are going to call it as Gottron's sign, Gottron's papule. So it is again in dermatomyositis. If there is a scaling hyperkeratotic changes present over the palms, we call it as mechanics hands, and this is very importantly seen in dermatomyositis. Next, if there is this violaceous macular erythema present over the upper back, we call it as a shawl sign. Again, a feature of dermatomyositis. So in the V sign, we are going to see the same changes of the skin over the anterior part of the neck. Anterior part of the neck. So this is V sign. And if the same violaceous macular erythema is present over the area where usually the guns pouches are going to be present over the body, this is called as Holster sign. Again, a feature of the dermatomyositis. So here you are able to see in the picture the violaceous macular erythema present. Next is in the scleroderma or systemic sclerosis, we are going to see the Raynaud's phenomenon, in which there is going to be the on a cold exposure, there is going to be this color changes which happen, which are going to be easily remembered with the help of this mnemonic PCR. So initially there is going to be pallor, that is whitish discoloration. Later on there is going to be cyanosis, that is bluish discoloration of the skin, and ultimately there is going to be rubor or red discoloration, and this is called as a Raynaud's phenomenon. This is what is called as Raynaud's phenomenon. In the systemic sclerosis, the skin is going to appear both white as well as black. That is hypopigmentation and hyperpigmentation will be present alternatively. This is what is called as salt and pepper skin or salt and pepper sign. Next, in the discoid lupus erythematosus, which is also called as DLE or chronic cutaneous lupus erythematosus, we can see carpet tax sign, which is also called as a tin tax sign, or it is also called as cat tongue sign. Okay, so basically in DLE, the lesions are going to have adherent scales. So if you remove the scales, we can see projections of the scales present underneath because they are going deep inside the hair follicles, leading to scarring alopecia. So this appearance, it is called as tin tack sign or carpet tack or cat tongue sign. The DLE lesions, if they are present over the concha, we call it as Schuster sign. In the erythema multiforme, remember the most important, most common infectious cause is the herpes simplex viral infection. The lesions are the target lesions, or we call it as target sign or iris sign or bullseye lesion, where there is going to be a central erythema followed by a intermediate zone of the pallor and ultimately peripheral zone of erythema, giving rise to the target lesion. So it is called as target sign. In the genodermatosis, remember the neurofibromatosis type 1, we can see the presence of the axillary freckling. Freckles present in the axilla is pathognomonic sign of neurofibromatosis type 1 called as Crowley sign. So can you name if there is a hyperpigmented lesion which is more than 1 centimeter in size over the body of NF1? What is the name given to that? Please put your answer in the comments below. Next, in the NF1, we are going to have this buttonhole sign, where if the neurofibroma is pressed with the finger, we can see that the lesion is going to allow the finger, it will yield to the finger as if we are putting the finger through a buttonhole. So this is called as a buttonhole sign. In the nutrition, very important buzzword, which is Castle's necklace. So basically the pellagra patients are going to have the features of the 3Ds. I hope all of you remember: photodermatitis, diarrhea and dementia. So the photodermatitis, if it is happening over the neck, we can see the presence of the dermatitis along the photoexposed area, giving rise to the necklace shape. This is called as Castle's necklace. Very important. My question for all of you: what is the precursor amino acid for the vitamin B3? If you know the answer, please put it in the comment section. I will give you two options: tyrosine and tryptophan. Please put your answer in the comments. Next, in the kwashiorkor protein malnutrition, we are going to see alternating bands of the hypopigmentation and hyperpigmentation of the hair, just like the flag. So this is what is called as a flag sign. In iron deficiency anemia, we can see the spooning of the nails, which is called as the koilonychia. Koilonychia, so concave deformity of the nail plate. In the acute pancreatitis, we can see the ecchymosis present peri-umbilically, or it can be present over the flanks. So the peri-umbilical ecchymosis, I hope all of you know, petechiae purpura ecchymosis, basically RBC extravasation will be there from the blood vessels into the skin. So peri-umbilical ecchymosis is Cullen's sign, and flank ecchymosis is called as the Turner's sign. Turner's sign, you are able to see here, peri-umbilical and flank ecchymosis. This can also be seen in the ruptured ectopic pregnancy and retroperitoneal hemorrhage also. In the amyloidosis or the base of the skull fracture, we can see the periorbital ecchymosis, just like this cute raccoon. So if this raccoon is very cute, please do hit that like button. Okay, so and if this video is useful also, please do hit that like button. So you are able to see the raccoon shaped eyes due to the periorbital ecchymosis. This is called as raccoon eyes. Next, in the nails, remember, if there is liver failure, that is cirrhosis, we can see the Terry's nails, which are basically the nails which are going to be completely white in color. Just the distal band of the normal color will be remaining. Rest nail plate will appear as if it is ground glass like appearance. So this is what is called as the Terry's nails. And remember, in the hypoalbuminemia and the nephrotic syndrome, there is going to be this transverse white bands which are present parallelly. This is called as Muircase nails or Muircase bands. In the urticaria pigmentosa, which is also called as cutaneous mastocytosis, which affects the children, the trunk is going to have the multiple hyperpigmented macules and patches. So if we are going to apply small gentle stroke over one lesion, we are going to see the histamine will be released from the mast cells, because of which there is going to be a wheal formation. This is called as, very important, Darier's. And remember, Darier's disease is different. In Darier's disease, we are not going to see the Darier's sign. This was once asked as a question, so I am just reinforcing that point. So here you can see the healing of the lesion on application of the stroke. Can you tell me what is the difference between the Darier's sign and the dermographism? If you know, put it in the comment section below. In atopic dermatitis, remember, the perinasal and the perioral pallor will be present. So this is looking like a headlight. So this is also called as a headlight sign. And you can see the cheeks are very much dermatitis features are present. And the presence of the lateral third of the eyebrows loss. This is called as Hartoghi sign. This is also seen in atopic dermatitis. So in the other video, I have already discussed Hartoghi sign in one of the infectious diseases. If you remember what is that infection, please put your answer in the comments. I will give you a clue. It is due to the Mycobacterium leprae. In atopic dermatitis, we can also see this antennus sign. Basically, in this atopic dermatitis, patients are going to have the keratosis pilaris, which is also called as chicken skin. The lesions are going to be appearing as a hyperkeratotic papular lesions on the sides of the arms. So if you put a light from the side, we can see that it will shine because of the long strands of the keratin which are present here. So you are able to see the strands of the keratin. So this is what is called as an antenna sign. Next, please remember, in the hair, the alopecia areata, which is autoimmune disorder in which the lymphocytes are going to damage and destroy the anagen hairs, we can see this important cordability sign. What is cordability sign? So before that, you need to understand what is this exclamatory mark here. So you remember, the proximal hair is going to be very thin and the distal part is going to be very broad. So because of this, what will happen? The hair will be very fragile proximally. So if you apply pressure with the finger over the hair, it was observed that it will easily kink or bend at the proximal part. So this is what is called as cordability sign. Very important, seen in alopecia areata. In trichotillomania, the patients are psychiatric patients. They are going to pull their own hairs, because of which what will happen? There is going to be a vertical split in the hair, inside which there is going to be deposition of RBCs and proteinaceous material and RBCs, giving rise to this hamburger sign. So here you can see that this is the hair, and this is another half of the hair. So in between this, we are able to see the RBCs and proteinaceous material present just like this hamburger. So this is called hamburger sign. There is a cartoon character called as Friar Tuck. So you can see that in that cartoon character, margins of the hair are going to be normal, but at the central part, there is going to be loss of the hair. So in the patients of trichotillomania, the same appearance is seen. So this is given a name called as Friar Tuck sign. So I hope this video was helpful. If it was helpful, please do hit that like button. Also do subscribe to this channel, and you can comment PDF if you want a PDF, and anything else is remaining as important sign, you can put that in the comments below. I thank you so much. We'll meet in the next video. Happy learning. Till then, Sarvam Sri Krishna Arpanam Sarve Jana Sukhino Bhavantu. Bye bye.